My name is Ana Cristina Wong, and I want to talk about Tofacitinib as induction and maintenance therapy for ulcerative colitis. First, I have the definition of ulcerative colitis, that is a condition that causes inflammation and ulceration of the inner lining of the rectum and colon. Tiny ulcers develop of the surface of the lining, and these may bleed and produce pus. The inflammation usually begins in the rectum and lower colon, and it also may affect the entire colon. If UC only affects the rectum, it is called proctitis, while if it affects the whole colon, it may be called the total colitis or pancolitis. Then the definition of tofacitinib is an effective oral medication inhibitor of Janus kinases 1, 2, and 3 with in vitro functional specificity for kinases 1 and 2 and 3 over kinase 2, which is expected to block signaling involving gamma chain of the surface receptors for multiple cytokines. In the applications of medicine, it's used for rheumatoid arthritis, baldness, alopecia areata, ulcerative colitis, and prevention of organ allograft rejection and psoriasis. It has its cons and pros. The cons, it may increase your cholesterol levels, stomach pain, yawns of the skin or eyes, loss of appetite, dark urine, depositions of clay color, vomiting, rash, pale skin, difficulty of breathing. The pros, it could allow the patients with UC to return to their daily activities in the absence of clinical symptoms. The method, the design of an 8-week, 3-phase randomized double-blind placebo-controlled trials of tofacitinib therapy in adults with ulcerative colitis. Inductive induction 1 and 2 trials with 598 and 541 patients, respectively, who had moderately to severely active ulcerative colitis despite previous conventional therapy or therapy with a tumor necrosis factor antagonist, were randomly assigned to receive oral tofacitinib at a dose of 0.5 milligrams, 3 milligrams, 10 milligrams, and 15 milligrams, or placebo, administered twice daily. Patients were treated for 8 weeks and followed for 4 weeks afterward. In the results, in the Octave Induction 1 and 2 trials, the rate of oral infection and serious infections were higher with tofacitinib than with placebo. In the Octave Sustain trial, the rate of serious infection was similar across the 3 treatment groups, and the rates of overall infections on herpes zoster infection were higher with tofacitinib than with placebo. Across all 3 trials, adjudicated no melanoma skin cancer occurred in 5 patients who received tofacitinib, as in 1 who received placebo. As compared with placebo, tofacitinib was associated with increased lipid levels. The trials followed successfully phase 2 trials in which patients with moderately to severely active ulcerative colitis who received 15 milligrams tofacitinib twice daily saw the significantly higher response rate at 8 weeks than those who received placebo. In conclusion, in patients with moderately to severely active ulcerative colitis, tofacitinib was more effective as induction and maintenance therapy than placebo.